Good evening and welcome to the clinic. Do you have an appointment with us this evening? That's right, you have the thorough cranial nerve exam scheduled for 3:30, and I see that you are just a few minutes early, which we do really appreciate. Thank you. I just have a few questions for you before we begin with the exam today. Is that okay? Perfect. Thank you so much. So first, I just need to confirm your full name, please. Okay, good. And your date of birth. Great. Okay, and your current address, please. Excellent. And can you remember the last time you had an appointment with us? Okay, perfect. So that should be up to date. Now, have you noticed any changes in your sense of hearing, sight, smell, taste, or touch? Okay, just anything out of the ordinary? Okay. Very good. So this is more of a routine checkup with no specific concerns, is that right? Perfect. I love to hear it. Well, if you don't mind, just go ahead and sit back and relax. Can I get you anything to drink? Water, tea, orange juice? Okay, perfect. Well, just sit back, relax, and we will begin straight away with your cranial nerve exam. Okay, are you feeling comfortable and relaxed? Perfect. Well, if it's okay with you, I'm going to begin with just a quick visual inspection of you, and I'm also going to feel around on your face, your hair, and a few other places. Is that okay? Okay, perfect. So I'm just going to start at the top of your head, just parting your hair. Good. And I'm inspecting here for any dryness, patchiness, or anything else that might be out of the ordinary. Okay, your hair looks very nice and well maintained. I'm just going to take a quick look at your ears here, your other ear, behind it, behind this ear. Okay, and please tell me if there's any tenderness at all. Okay, perfect. Now I'm going to press on your sinuses here and here, okay? So right there. Okay, and then on your cheeks. Okay, great. And I'm just going to massage your jaw in circular motions, okay? Any tenderness there? Okay. And now will you please open your jaw and close? Good. And open and close. Okay, perfect. Now I'm just going to feel under your chin and your lymph nodes there. Any tenderness? Okay, good. And just looking at your arms, brushing down your arms. Okay. Now if I could just see your hands, please. And I'm just going to gently pinch each of your fingers to check the capillary refill. So start with this hand. Perfect. And the other hand, please. Okay, great. Capillary refill is normal and under 2 seconds. That is perfect. Now, if you don't mind, I have a bit of a bright light, and I'm just going to inspect your hair, your face, and inside your mouth, okay? This will be very brief. Just taking a look at the top of your head. Okay, that's good. And your ears, the other side. The light just allows me to get a better look at things. Now, if you could please open your mouth wide and say ah. Good. And I'm just going to take a look in there, inspecting your teeth, hard palate and soft palate, and your tongue, and the uvula in the back of your throat. Say ah one more time. Thank you so much. That is perfect. Now, if you wouldn't mind, I'm going to just gently place my hands on your thyroid gland. Okay. And if you'll just swallow for me. Okay, that is perfect. Thank you so much. Next, I'm going to listen to your heart and your breathing with this stethoscope, okay? So just follow my instructions. This should be totally relaxing and there should be no discomfort at all. Please tell me if you get lightheaded at all, okay? So first I'm going to place this on your chest, okay? And you can just breathe normally. Great. Moving it over just a bit. Now, please take a deep breath in through your nose and breathe out through your mouth. Great. And the other side. Breathe in through your nose. Breathe out through your mouth. Good. Now just bringing this around your back. Again, breathe in through your nose. This time hold the breath for 5, 4, 3, 2, 1. And breathe out through your mouth. Good. And just once more around the other side of your back. Okay, taking another deep breath in. Hold this one for 3, 2, 1, and breathe out through your mouth. Okay, that is perfect. Your heart is beating rhythmically, and I don't hear it skipping any beats. And your breathing is strong. I don't hear any crackling or anything concerning in your lungs, so that is perfect. So, are you comfortable so far? Do you have any questions? Okay, perfect. Well, you are doing very well, and it is time to move on to your eye exam, okay? So we're going to start again with a bright light. There will be no flashing, just a bit of a bright light, okay? So first I'd like you to look straight at my nose, and I'm just going to take a look at each of your pupils. Seeing how they react to light. Good, and the other side. Perfect, and I have this little chart here, so I'm going to assess the size of each of your pupils. So this one is about a 3, good, and the other side. About a 3.5, but that is just fine. Now, if you wouldn't mind, go ahead and focus both of your eyes on this light, just as it moves around. Good. Good. I'm assessing whether your eyes are tracking smoothly or if they are skipping. Okay. And is there any blurriness or double vision as you were doing this? Okay, that's good. Very good. Very good. Great. Now we're going to test how well your eyes can adjust between looking up close and far away. So if you'll just look at this finger right here. Good. Now can you look at the light? Now can you look at the background? Bringing this a little closer. Please look at my finger. Look at the light. Look at the background. Look at my finger. Look at my nose. Look at the light. Look at the background. Good. Now bringing this very close. Can you look at my finger? Look at the background. And look back to my finger. And when I take my finger away, I want you to look back at me. Very good. Did you have any difficulty with that at all? Okay, perfect. Moving on then, we're going to test your color vision now. So I have these different colored paddles to start with, and I simply want you to tell me what color they are, okay? Are you ready? What color is this? Very good, that is green, okay. Next, what color is this one? Red, excellent. Okay, and next up, I'm going to show you 3 different paddles, and I want you to tell me which one is purple, okay? So, which of these paddles is purple? This is A. This is B. And this is C. Once more, I'll show you which one is purple. A, B, or C. Very good. If you said C, this one, then you are correct. And now if you would just tell me, to the best of your ability, what color is this? Good. I would say yellow, although the background in my office here may be distorting that for you a bit, so no worries if that's the case. Next, still testing your color vision, I have a few little squares here. They each have a number written inside of them, and your job is simply to tell me what the number is that you see, okay? So this is the first one. What number do you see? Good, 3. And this one, what number is that? Great, that one is 15. And if you're struggling with any of these, just do your best, okay? What is this one? Good, that one was 74. We're testing for multiple different kinds of color blindness here. So what is this one? Can you read that one? 6, excellent. And next we have this one. You see that one? Good, it's 5. And how about this one? This one is tough. Just take your best guess at it. Great, that one is 5. And just one more, okay? What is this one? Yes, Yes, that is 12. Excellent job. Just putting those away now. You did very well with the color vision assessment. Next up, I have this chart here, and I'm just going to use this dim little light to indicate which lines I would like you to read, okay? So just holding this at about the distance that you would read a book, okay? Can you please read line 3 for me? Great. Now can you just read this letter for me that I'm circling right here? Excellent. And can you read this letter that I'm tracing? Good. Now can you read this letter that I'm tracing? Great. And can you read this line starting here? Great. And finally, can you read that letter right in the middle of the bottom line? Great. Switching over to the other side, can you read this number that I'm tracing right here? Good. And what about this number that I'm tracing right here? Good. 3. And can you tell me if this E is pointing to the right, left, up, or down? What direction? Good. And what about this E? What direction is that E facing? Okay, good. And can you read these 3 letters, starting with this one, good, and this one? Perfect. Excellent job with that. And that concludes your eye exam, okay? So next I'm just going to have you do some simple facial movements with me, if you don't mind, okay? So if you can go ahead and look up at the ceiling. Good. Can you look down? Can you look to the left? Excuse me. Can you look to the right? Very good. Can you roll your eyes in a circle? Good. Then can you roll them the other direction? Good. Can you look straight at my nose? And when I say blink, I want you to blink as soon as you can, as fast as you can. Ready? Blink. Good. Blink. Good. Blink. Excellent. Now keep looking at my nose. I'm just going to gently tap on your forehead, and we're going to see if we can trigger a blink response here. Don't force it. Tap, 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 tap. Okay, great. Now can you squeeze your eyes closed as tight as you can? I'm just going to try to open them. Just fight, 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 fight. Okay, great. Now if you could give me a big smile. Good. Can you frown? Okay. Can you puff out your cheeks? And just keep the air in them. I'm going to tap on them. Tap, 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 tap. Good. Can you stick your tongue out? Great. And can you press your tongue into the side of your cheek? And I'm just going to press. Resist, resist, resist. Good. Can you press it into the other side of your cheek? The other cheek. Resist, resist, resist. Good. I'm going to put my hands on your jaw. Just go ahead and clench your jaw. Good. And relax. and clench it and relax. That's great. Now, can you raise your eyebrows up? Okay, great. And can you flare your nostrils? Very good. Now, just a few basic movements of your head and neck, okay? Nothing too difficult, nothing too challenging. If you would please just put your chin to your chest. Good. Now can you tilt your head back and look at the ceiling? Great. Now just put your ear to one shoulder. Maybe your neck cracks a little. That's normal. That's just a bonus. And to the other side. Okay. Can you roll your head in a circle for me? Great. Can you roll it the other direction? Good. And can you look over one shoulder and the other shoulder as far as you can without it being uncomfortable? Perfect. Now, finally, if you could just raise your shoulders up to your ears. Good. And release them. Excellent. Finally, I just need to see your hands, please, okay? So if you could make your hands into fists and spread your fingers as wide as you can. Good. Can you make an okay sign with both hands? Give me a thumbs up with both hands. Good. Can you show me just your pinkies? Perfect. And can you clasp your hands together? Great. Okay. You can relax now. Next, we're going to test your sense of hearing. So for this, I would like you to please close your eyes. Close your eyes. No cheating, okay? So starting off simple, please just say yes whenever you hear a sound. Good. 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 Great. Perfect. I'm going to make a sound by your ears, and this time I want you to say yes when the sound stops. Ready? Good. And again. Great. Now I'm going to make two sounds, one closer to you and one farther away. So I simply want you to tell me if sound A or sound B is closer to you. Are you ready? This is sound A. This is sound B. Which one was closer? Very good. Sound A. And again, this is sound A. This is sound B. Which one was closer that time? Very good. Sound B. And once more. But this time I'm going to do 3 sounds, and I want you to determine which sound was the closest to you. Are you ready? This is sound A. This is sound B. And this is sound C. And which one was the closest to you? Very good. It was sound B. Okay. Now I'm going to gently snap, and I just want you to tell me how many times you hear me snap, okay? Ready and go. How many snaps was that? Very good. That was 8. And again, how many snaps? How many times was that? Very good. 5. And again, how many snaps? How many times was that? Very good. That was 2. Now I'm going to be snapping. And just say yes when you hear the snaps stop. You don't have to count them. Ready? Excellent, excellent job. Finally, I'm going to whisper something in each of your ears, and I just want you to repeat back what you hear me whisper. Are you ready? Green means go. Green means go. Very good. And the other side. Red means stop. Red means stop. Excellent job. You can go ahead and open your eyes again and readjust. Now, I suppose I should have done this sooner, but I am going to take your blood pressure now, okay? So if you would just put both of your arms out, just lay them out with your palms facing up. We will start on this side, okay? Just securing the cuff on your arm, okay? And there shouldn't be any discomfort, so just let me know if it becomes too tight, okay? Are you ready? Very good. It is normal on that side. And I do like to take your blood pressure on both sides just to make sure there is no discrepancy, okay? So I'm just going to secure the cuff over here now. Okay, are you ready? Excellent job, and it is just about the same on both sides, which is a very good sign, okay? Now we're going to test the sensation in your face, okay? So if it's alright with you, I'm just going to gently touch you on the face. I just want you to say yes when you feel something, okay? Are you ready? Good. Great, and the other side. Good, good, great. Okay, perfect. Next, we're going to do the sharp or dull test, okay? So once again, I have this little light here, and it has a pointy side and also a dull side. So when I poke you with it very gently, I just want you to say if it feels sharp or dull, okay? Okay, so just starting here, is that sharp or dull? Good, sharp. And how about here? Sharp, good. Dull. Dull, good. Sharp, good. Sharp, great. Dull. Dull. Sharp, excellent. Can you please tell me, does it feel equally sharp here and here? About the same? Good. And how about here? And here, those feel about the same? Good. And finally here. And here, those about the same as well? Okay, perfect. To conclude the test of your sensation, I have this metal reflex hammer. I'm going to gently touch you on the face with it, and I just want you to tell me if it feels cold or hot. Ready? How does that feel? Cold, very good. And just tell me, does it feel equally as cold on this side? Okay, perfect. Now, because I have this in my hands already, we'll go ahead and test your most basic reflexes, okay? So I'm going to start with your arms, just in the crook of each of your arms. So if you'll just lay them out flat for me, as you did when I took your blood pressure. Okay, and I will start on this side. Ready? Just relax. Perfect. And the other arm as well. Just relax. Perfect. Next, I'm going to just place my fingers on your jaw, and I'm going to tap on my fingers, so I will not be touching your face with the hammer, but just go ahead and relax your jaw, let it hang open. That's perfect. And finally, we will test the reflexes in your knees, okay? So just let your legs hang off of the bed. Relax them. I'm going to start with this side. Good, that was a great response. And the other side as well. Perfect. That one was a little more stubborn, but it still reacted accordingly. So next up, we're going to briefly test your sense of smell, okay? So I have a couple of different fruits here that I would like you to smell and identify for me, okay? And I will be covering them with my hand so you can't see. Just go ahead and take a deep breath in. Really smell it. What does that smell like to you? What fruit? Excellent. That was a strawberry. And just one more. This is also a fruit. Give it a good sniff. And what does that one smell like to you? Excellent. That one was an orange, or I would also accept a lemon or any other citrus fruit. Okay, perfect. And last but certainly not least, we have to check your sense of taste. So just a quick question first. Are you able to taste things that are sweet, salty, bitter, spicy, umami? Okay, that's good. And we will just test that really quick. So I have some powder here I'm going to sprinkle on your tongue. You're not allergic to anything, are you? Okay, perfect. Go ahead and open wide, stick out your tongue. I'm just going to sprinkle that on there. And what does that taste like to you? Good, that is sugar. Excellent job. Well, let me see here. I believe that concludes your thorough cranial nerve exam tonight. How do you feel? Good, good. I'm glad to hear that. Do you have any questions or concerns at all? Okay, well, perfect. I can tell you that I have no concerns whatsoever. You passed with flying colors and you seem to be in excellent health, okay? But as always, if you ever need anything or have any questions, don't hesitate to come back. I always love seeing you in here. Awesome. Well, thank you so very much for coming in for your appointment this evening. I hope you have a wonderful rest of your night. Goodbye.